Well, a new report from Forward Analytics, a Wisconsin-based research group, shows our state is in the middle of an epidemic of drug overdoses.
The crisis is being driven largely by illegal fentanyl.
It's now, listen to this, the #1 killer of Wisconsin residents ages 25 to 54. UW Health Chief Quality Officer Dr. Pothof is here with more on that. That statistic is stunning, the death rate in Wisconsin, #1.
Yeah, I think if you go to a large group of people and you say, what's the #1 killer in Wisconsin for adults aged 25 to 54, some people will say trauma, they'd be wrong. Some people might say cancer, heart disease, they'd be wrong. It's opioid overdose. That's the #1 killer of people 25 to 54 in Wisconsin.
What is fentanyl and why is it so dangerous?
So fentanyl belongs to a class of medication called opiates, and opiates go way back. Heroin is probably the one folks are familiar with, and it was a drug that's used to treat pain, and we use fentanyl in hospitals to treat severe pain. But what's happened is a lot of the illicit drugs coming from all over the world are laced with fentanyl. Fentanyl is a very, very powerful opiate. A very small amount can reduce your drive to breathe such that you stop breathing and you asphyxiate to death. And that's what we're seeing in our communities and communities around the country, are folks dying from inadvertently taking medication or a drug that they didn't know was contaminated with so much fentanyl that it would kill them.
And why is it finding its way into all these drugs?
Yeah, I think, because it's easy and cheap to manufacture in illicit laboratories around the world. So it's easy to get these into illicit substances. And if you're addicted to opiates, a little bit helps with that, as far as that's what you're looking for when you're looking for the drug. But it's not regulated like a drug would be in a hospital. Sometimes these things contain many, many times more fentanyl than you could possibly survive. And people unwittingly don't know that. They take it and they die.
Can you smell it or taste it? Is it always in a pill form, or it's very...
Yeah, odorless, colorless, can't taste it, can be in a liquid pill form. It could be in anything. It's really hard to know.
And how quickly do the symptoms come on and take over?
A lot of it depends on how people take it, but if they inject it or if they snort it, we're talking a matter of minutes. And it's why you see a lot of communities having Narcan, which is the antidote for opiates, easily available. It's oftentimes not quick enough to have an ambulance or EMS with Narcan. That Narcan needs to be with that person when they overdose, and someone else would likely need to be able to administer it, or it's too late. By the time EMS gets there, you may have suffered brain damage, or you may just be dead.
Yeah, it's terrible. Speaking of injections, there's a new injection for babies.
Yeah, this is interesting. There's an advisory panel that just approved a medication, an injection for infants that reduces by 75% their likelihood of getting severe RSV. We've been talking about RSV a lot this last year. For older folks, there's some vaccines out there. This is the first thing we have for infants. It's not a vaccine. It doesn't train your body to make antibodies and provide durability, but we inject those antibodies into the infant, provides that good protection for a good number of months when they're little and really susceptible, and it's already approved in Canada, Europe. I think it's likely we'll see it here. Good news for parents with young kids. RSV hopefully will be less of a threat to them in the future.
Yeah, it was a bad year last year. Do you think it could happen as soon as this winter, possibly?
I think we could see this FDA approved by this winter. That would be great.
That's exciting news.
Yeah.
Good to end on a good note.
There we go.
Yeah.
Modern medicine moving forward.
There we go.
Doctor, thanks for being with us today.
Thanks, Dr. Pothof.